first, around 50% of men and 10% of women are suffering from a problem that many regard as a bit of a joke. But for those who have it, it's often the cause of extreme embarrassment and distress. It can even break up marriages. It's snoring, and we're going to look at what causes snoring and how it can be helped. This is a sound which resonates across the skies of Britain. At some time, almost all of us will be responsible for this noise. But for some, it's a nightly event, and although considered a subject for humour, snoring is a condition that can wreck relationships and ruin lives.
My wife thought I was going to die one night. She just heard me performing in bed and thought that I literally was going to stop. Well, I stopped breathing, and she didn't know whether I was going to start up or whether she should pump me or what.
Mary, my partner, was the one who really suffered. And she's a very light sleeper. And it actually meant that she always had a broken night. She always would hear at some point, and then she would never fall asleep again. So we had separate rooms.
How long was that for?
Oh, this has gone on for 10 years.
On a sailing trip, which I used to do quite frequently, but on one occasion the crew somewhat mutinied and decided that I wasn't the skipper, but as one of the crew members, was preventing them getting any sleep. So I was put into the dinghy and cast some way away from the yacht.
Snoring is very common. It affects about a third of men in total, getting more common as we get older, and a lesser proportion of women, but particularly after the menopause. It's likely that about a half of men of my age snore habitually.
Despite snoring ruining marriages and friendships, creating exhaustion and even wrecking careers, for those willing to seek help, effective treatments, even cures are available. Here are some of the solutions. Lose weight. Less fat will mean more airway space in the neck. Reduce alcohol. Drinking before bedtime causes the throat to relax more and decreases the size of the airway. Continuous positive airways pressure. A mask worn at night which pumps air into the nasal passages. Nasal devices and drops, all designed to expand the airway space in the nose and throat. Laser treatment, to reduce the tissue at the back of the throat, and as a last resort, major surgery. All these methods are designed to increase the amount of airflow in your nose and throat, because doctors know the main cause of snoring. It's the uvula, the flesh at the back of the throat, which is the culprit.
That hangs down in the breathing passage and flaps around in the breeze. And without that, one wouldn't snore. The other thing that's important is how big that breathing passage is, because snoring only occurs if it's small enough. The things that make it small would obviously be inherited factors, but age is another factor. It gets smaller as we get older, as the muscles relax.
If you've tried to lose weight and cut down on alcohol, you may need a more radical method of treatment, like Peter Black, who's come to the sleep lab at St Thomas's Hospital to spend the night having his sleep assessed. Electrodes placed on his head will register brain activity, revealing his sleeping pattern. A sleep technician will monitor his progress throughout the night.
These are the recordings of brain activity, his eye movements, his muscle tone at the chin, his heart rate, leg movements, airflow and chest and respiratory movements. If I compress it now to show you 4 minutes, you'll see this person's got a very severe breathing sleep problem. He's actually stopping breathing every minute or so for up to about 30 seconds. Eventually he wakes up, takes a big gasp of air, the typical snort, and he's going to be waking up about 200 or 300 times a night, and he won't realise it.
Doctors believe a mask available on the NHS, worn at night, delivering continuous air pressure, will be the answer for Peter. It may seem cumbersome, but the result is a good night's sleep.
As he breathes during the night, he's breathing against a resistance, and it helps to keep his airways open, so he doesn't have these periods where he stops breathing. He gets into the deeper stages of sleep, and he wakes up feeling refreshed.
Alan Davey has been a snorer for 20 years. He set up a support group for snorers to discover more about his condition.
There wasn't anywhere that you could get information to read about it. There was no helpline, there was no patient support, and yet The medical profession have done a great deal of work on this subject, and a lot of research has been done, but the public didn't know about it.
Over the years, he found a number of low-cost solutions that can work.
All of these devices here work on the principle of increasing the size of the airway.
This is a nasal expander which keeps the nostrils open.
The device itself wants to be flat, and breathing is much, much easier.
Is that quite comfortable to wear?
Perfectly comfortable, yes. People have worn this playing tennis, and American footballers are wearing it to make breathing easier in sport even.
This blue device is a snore guard. It's placed in the mouth and prevents the user breathing through the mouth, creating the snoring sound. A similar device, again worn at night, brings the tongue forward to create more space. And simple nose drops may also do the trick, shrinking the lining of the nose.
It was recommended to me by an ex-Guinness Book of Records snorer, so if it worked for him, I think that speaks for itself.
Today, Archibald Galloway, a snorer for most of his life, is about to find his own way of dealing with snoring. He's answered an advert for a new private laser treatment to cure his condition, costing around £800. Patients are assessed first for suitability, as not everyone would benefit. The whole operation takes around 10 minutes. It's pain-free, but 3 days later, patients suffer a severe sore throat.
And what we do with this operation is we do shorten and stiffen the soft palate, which is the area of the back of the mouth that flaps around at sleep and causes a snoring sound. So there's a classic, which is almost invariably coming from the palate. Now, we should be able to create a situation where he can't make that sound at all. But once we cure that sound, there may be other sounds coming into play with the snoring, such as a sucking sound. We won't be able to cure that. So people's expectations have to be tempered by the fact that there's only one sound we can cure.
So what's the verdict?
Well, difficult to describe, really. Perhaps the smell and the smoke more than anything else. Bit of difficulty breathing. Certainly no pain of any consequence.
Jean-Pierre Hadef had this very same operation 4 weeks ago. For him and his wife, it's been a total success.
To spend the night with Mary is great, you know. It's lovely. It's lovely to be able to do that. I had not done that really for 10 years, to be able to think night after night we can get into the same bed and still be there in the morning.
For the latest information about snoring and for details of the British Snorers Association, please write to us for our free Carlton People information pack. The address is Carlton People, PO Box 101, London WC 2N 4AW. That's Carlton People, PO